Senator from Iowa.
President, thank you very much, and I thank Chairman Baucus for yielding me this time. And, Mr. President, I listened with great interest to the distinguished senior senator from Montana as he recounted the extraordinary lengths to which Democrats went on his committee in soliciting bipartisan Republican support in their drafting of the health reform bill in the Finance Committee. On both the Finance Committee, which Senator Baucus chairs, and on the Committee on Health, Education, Labor, and Pensions, which I chair, the majority party insisted on a process that was consistently open, transparent, and inclusive. At every step, the Democratic majority acted in good faith. Republican senators were fully involved during public committee hearings and markups, as well as in private discussions and negotiations. The ideas and amendments of Republican senators helped to shape the substance of the bill in a multitude of ways. In the Health Committee in 2008 and 2009, we held 47 bipartisan meetings on health reform, including 14 bipartisan roundtables, 13 bipartisan committee hearings, and 20 bipartisan walkthroughs on the bill. Then the Health Committee spent nearly 3 weeks during June and July marking up the bill, June and July of last year. To be exact, our markup spanned 13 days and a total of 54 hours. We went out of our way to accommodate our Republican colleagues who offered over 200 amendments. We adopted or accepted 161 Republican amendments on our bill. Mr. President, by any standard, this was an extraordinarily open and inclusive process. And I must point out that Democrats, in good faith and in the best spirit of bipartisanship, insisted on this inclusive process, despite numerous public statements by some Republican senators to the effect that their game plan was to delay and obstruct and filibuster and kill the bill. Indeed, the junior senator from South Carolina famously said, if we're able to stop Obama on this, it will be his Waterloo, it will break him. Even in the face of that, we said nonetheless, that's just one person. We're going to have an open and inclusive process. Many critics have said that Democrats pursued inclusion and bipartisanship to a fault. They've criticized us for consuming many months negotiating with Republicans, accepting their amendments, accommodating their ideas and objections, even in the teeth of their public declarations that they intended to kill the bill. Now, for the record, I am proud of the fact that we went the extra mile to include Republican senators and to incorporate their ideas and input. It was the right thing to do, even if the hand of cooperation and bipartisanship that we extended was rejected. Mr. President, with passage of the Patient Protection and Affordable Care Act, the 111th Congress has made history, just as previous Congresses did in 1935 by passing Social Security and 1965 passing the law creating Medicare. Each of those bills marked a giant step forward for the American people, and each was stridently opposed by defenders of the status quo. But in the end, Mr. President, a critical mass of senators and representatives rose to the historic occasion. They voted their hopes and not their fears. And as we now know, in retrospect, they passed laws that transformed America in profoundly positive ways. The health reform law that President Obama signed earlier today will also transform America in profound and positive ways. Indeed, it already has. Despite all the talk recently about how our nation has become divided and ungovernable, we have proved not only that we are governable, but also that we still have the capacity to take charge of our destiny and to act with boldness and vision. One prominent commentator said that passage of the health reform bill is, and I quote, a victory for America's soul. I couldn't agree more. Yet this new law is fully paid for. Indeed, it helps to reduce the deficit by $143 billion in the first decade and by a whopping $1.2 trillion in the second decade. That's deficit reduction. Yes, this new law includes important and long overdue measures to crack down on abuses by health insurance companies, abuses that leave all Americans, including those with insurance, just one illness away from financial catastrophe. No longer will health insurance companies be able to cancel your insurance when you get a serious illness. No longer will they be able to impose lifetime caps or annual caps on their payouts. No longer will they be able to systematically discriminate against women by charging higher premiums just because you're a woman. No longer, once this bill becomes fully operational, will they be able to deny coverage based on pre-existing conditions. In addition, the new law includes a whole array of provisions promoting wellness, prevention, and public health, something that I have personally championed for many years. This will finally begin to change the paradigm from our current sick care system to a true health care system, one that keeps people healthy and out of the hospital in the first place. This bill will begin to recreate America as a wellness society, focused on healthful lifestyles, good nutrition, physical activity, preventing the chronic diseases that take such a toll on our bodies and on our budgets. There's been a lot of talk about bending the cost curve in health care. And there's been a lot of different ways people have suggested how we bend the cost curve. Quite frankly, Mr. President, I think the one biggest way that we're going to be able to bend the cost curve is by focusing more on prevention. We know how to do it. We know what works. We know what saves money. We have good data on this. If you don't believe me, ask Pitney Bowes and what they did to their bottom line. Ask Safeway Corporation what happened to their bottom line in terms of health care costs when they put in place widespread prevention and wellness policies. So we have private companies out there that are doing wonderful things that we could be doing nationwide. And we can have the same kind of savings nationally for America as these private companies have for their bottom line. And there's one more critical reform in this new law. It includes the community first choice option, which represents a major advance in allowing people with disabilities and older Americans with chronic conditions to remain in their homes and with their family and community. And it will increase access to medical examination and diagnostic equipment designed to accommodate people with disabilities. And here I want to speak to all of my friends in the disability community in America. After the passage of the Americans with Disabilities Act in 1990, the next big hurdle was to break down the discrimination that exists in federal law that pertains to people who are eligible for institutional care, but who would rather live in their own homes than in their community. Right now, under federal law, if you qualify for institutional care, Medicaid must pay for that, If, however, you don't want to live in an institution and you want to live on your own, near your friends or your family in the community, Medicaid doesn't have to pay for that. And yet we know that for every one person in a nursing home, we can support 3 people with disabilities living in the community. So we've tried ever since 1990 to change this. We had the first bill in the mid-90s. It was called MECASA, the Medicaid Community Attendant Support and Services Act. Tried for a long time to get that through, and we could never get it done. And then in the last few years, we changed the name of it to the Community Choice Act, and we still couldn't get that done. Last year, about this time, I paid my first visit to then President Obama in the White House. I wanted a personal meeting with him to talk about this one issue, that if we're going to do health care reform, we cannot leave people with disabilities behind. And the one thing that matters most is to ensure that people with disabilities have their own choice about where they want to live. If they want to live in an institution, fine. But if they'd rather live by themselves, live in the community with their family and their friends, they ought to have that choice. President Obama agreed with that. And so began the long process. There's one part of this bill that not too many people know about, And I say to my friends in the disability community, we have finally overcome the obstacle. In this bill is the community first choice option, which then will allow the federal government, beginning in October of 2011, to begin to pay to states an increased part of their Medicaid payment so that people with disabilities can choose where they want to live, not where the government tells them they have to live. To me, this is a profound change in how we're going to treat people with disabilities in our society. This is one of the landmark disability rights parts of this bill. And not too many people know about it, but I think that after the signing of the bill today, people in the disability community all over America will know that it's in there. So, Mr. President, these are important landmark reforms that benefit all Americans. But as a commentator put it, the new health reform law is also a victory for America's soul. At long last, we are realizing Senator Kennedy's dream of extending access to quality, affordable health insurance to every American. We're ending the last shameful bastion of legal discrimination and exclusion in our country. I've stated this before, and people said, what are you talking about, discrimination? Well, over the decades, we have outlawed discrimination in our country on the basis of race, color, national origin, based on gender. We've outlawed discrimination also based on disability, the Americans with Disabilities Act, 1990. But until now, think about it. It's been perfectly legal to discriminate against our fellow Americans because of illness, because of sickness, to exclude tens of millions of our citizens from decent health care simply because they can't afford it. Think about that. Now, and I hear some people talking about setting up pools. They're going to have a pool here and a pool here, a pool for the elderly, a pool for high risk, a pool here and a pool there. Different people get in these different pools. My friends, that is nothing more or less than blatant discrimination. Are we not all one American family? That's what we said when we passed the Americans with Disabilities Act. This is our family. They shouldn't be shunted aside, separated out. We said the same thing on the basis of race years ago, the Civil Rights Act, basis of women, national origin. Well, now, with the signing of the bill today, we have said no longer are we going to discriminate against people because they're sick. Think about that. No longer are we going to discriminate against people simply because they're sick. This is a profound change in the way that we are going to deal with each other as a society. So when President Obama signed that bill this morning, he set in motion a series of changes that will tear down these last barriers of discrimination and exclusion. So that truly is a great moral victory. Yet it is a victory for America's soul. It's a victory that every American can be proud of. And on that score, I certainly include our Republican friends. In the end, not a single Republican in either the House or the Senate voted for health reform. Now, I say that's unfortunate. But make no mistake, Republican ideas are much a part of this new law. In our committee, the HELP Committee, which I chair, Republicans were full-fledged participants. As I said, they offered 210 amendments. We accepted 161, many of them making substantive contributions to the bill. As others have pointed out, our national health reforms are similar in many respects to the very successful reforms undertaken by Republican Governor Mitt Romney in the Commonwealth of Massachusetts. I fully predict that as with Social Security and Medicare, the changes in the new health reform law, as they become better known and take effect, will win overwhelming bipartisan support among the American people. In the near term, however, it is disappointing that some Republican legislators, I think maybe taking their cue from the more extreme voices on talk radio or Fox TV, are pledging to repeal this new law. In fact, the distinguished minority leader, Republican leader, a couple of weeks ago in a press conference said that their motto was going to be this year that if we pass this bill, their motto was going to be elect Republicans, they'll repeal it. Well, this strikes me as bad public policy and, quite frankly, bad politics. Do Republicans really want to repeal the ban on denying insurance coverage due to pre-existing conditions? Do they really want to repeal the ban on insurance companies canceling your policy if you get sick? Do they really want to repeal the ban on annual and lifetime benefits payments? Do they really want to repeal the dramatic shrinking of the donut hole? Do Republicans really want to take away from you, the American people, the fact that now in law your child can remain on your policy until they're age 26? They want to take that away from you? They want to take away from you the right you have now, the right under law, that your child, no matter how sick your child gets, may be born with a disability, may be born with an illness, insurance company cannot discriminate against your child based on a pre-existing condition. That's the law of the land. Do Republicans really want to take that away from you? Mr. President, I would strongly advise against these scorched earth tactics. This health reform bill has passed, been signed into law. It's now time for the bitter partisan rancor to stop. It's time to move forward as a united American people, just as we did with Social Security and Medicare. It's time to put politics aside, put our country first. Mr. President, today we have before us this reconciliation bill that includes a number of modifications to strengthen the reform bill that President Obama signed earlier today. And the bill he signed earlier today was the exact same bill we passed here on Christmas Eve of last year. But there's something else. This reform bill also includes reforms in student lending program that in their own way are also profound and historic. Let me just mention a few of these provisions that will build on the new health reform law. The new health insurance, Senator Baucus said earlier, all families between 133% and 400% of poverty will see lower health care costs. The bill will shrink and ultimately do away with the donut hole in Medicare prescription drug program. We have new provisions cutting back on waste, fraud in Medicare and Medicaid. And in fact, these were some ideas proposed by Republicans at the White House summit, and we put it in the bill. It increases funding for community health centers by $2.5 billion for community health centers. New consumer protections for employer-provided health plans that are grandfathered in by the health reform law. In addition, the bill provides a provision, and the bill includes a provision that is critically important to ensuring that our health care providers and hospitals are fairly reimbursed. Many folks know that Medicare varies reimbursement based on geography. That means that many rural states, such as Iowa and Oregon, Arkansas, Minnesota, and many others, are reimbursed at much lower rates than urban areas, regardless of the quality of the services they provided. This bill helps to right that, to address the geographic disparities, both for doctors and hospitals. In addition, we have received a written guarantee from Health and Human Services Secretary Kathleen Sebelius for further action to reform Medicare reimbursement rates. This will finally move us to a fairer, more effective reimbursement model that emphasizes quality over quantity. Mr. President, as I said, this reconciliation bill includes both health care and education provisions. The education title of the bill includes landmark provisions to make college more affordable and accessible. It does so by eliminating tens of billions of dollars in wasteful subsidies to banks, redirecting most of that money to low-income college students in the form of increased Pell Grants. The status quo in student lending is just incredibly wasteful. It's like a bizarre Rube Goldberg process that makes no sense. Think about the present system. The federal government pays fees to private banks to make entirely risk-free loans using taxpayer money. The loans, which are already guaranteed by the federal government, are then sold back to the federal government. The banks pocket tens of billions of dollars, taxpayers' dollars, in fees and totally risk-free profits. Well, this is a brazen case of corporate welfare, a huge government giveaway to bankers and to Sallie Mae. It's time to end it. This bill does. Simply put, this bill cuts out the middleman, saves $61 billion over the next 10 years, and gives it to students. The remainder, we have invested, as I said, for more generous Pell Grants. We reduced the deficit by $10 billion. We have deficit reduction in there. We increased the Pell Grants from 2010 to 2017, from $5,550 to $5,975. And then we put in a cost of living increase on Pell Grants based on the Consumer Price Index. This $36 billion includes an investment of $13.5 billion right now to the Pell Grant, right now, to fill a hole in the Pell Grant. That will increase student aid this year for students going to college, low-income students who need that help. It also invests $2.5 billion in historically black colleges and universities. It also provides money to students' services so that they can support students and give them the support they need to stay in school and to graduate. Money that will help nonprofits do that. So again, Mr. President, this reconciliation bill builds on and strengthens the health reforms and the law signed by President Obama today. As I have said many times in the past, I looked upon the health care bill we passed in December as a starter home, something on which we could build. We'll make modifications now and in the future. There will always be modifications. This is a bill. It's a law. We make changes as we go along. And so we're making some of those fixes today that bridge some of the differences between the House and the Senate to make some needed changes. Congressional Budget Office, again, said that the deficit reduction will be $143 billion in the first decade, an additional $1.2 trillion in the second decade. Big deficit reductions. Well, I am sorry that the Republicans seem to take a pride in their reputation as a party of no. We all remember William F. Buckley's conservative motto, William F. Buckley, the father of the conservative movement. He said the role of conservatives is, and I quote, to stand athwart history yelling, stop. Well, that's exactly what our Republican colleagues did by filibustering and trying to kill health reform. That's exactly what they're trying to do now, to obstruct and kill this reconciliation bill. But it won't succeed. We are going to get the reconciliation bill done. We're going to get it passed, and we're going to move beyond this. We're going to move beyond the rancor and the bitterness and bring our American family together. Bring them together so that everyone is guaranteed the right to health care. That we stop the abusive practices of the health insurance industry that we've seen in the past. So by any measure, this bill is good for the American people. It's good for students. It's good for our colleges. It's good for our community colleges, our private colleges, and getting rid of the guaranteed loan program and going to a direct loan program. And it's also good for the health of the American people. Madam President, as I said in the beginning, this bill is good for the soul of America. It's good to remind us that we're once again an American family, that no one should be discriminated against simply because they're sick or have an illness or because fate has dealt them a blow of becoming disabled. That's what this bill is about more than anything else. It's time to get on with it, get it passed, and move on. Madam President, I yield the floor.